My name is Margaret Faenza. Prior to nursing anesthesia school, I was an ICU nurse for a year and a half and a med-surg nurse for 2 years. I'm excited to take this course because I've always been very conscientious of other cultures, lifestyles, and values outside of my own, starting with the friendship I formed with an exchange student at the age of 10. She was from Mexico, and we are still best friends. My understanding of how healthcare is influenced by a patient's culture started with my involvement in the Lillian Carter Center for International Nursing at Emory School of Nursing, where I participated in a mission trip to Jamaica and also assisted with healthcare services to rural migrant farm workers in South Georgia. I'm hoping through my participation in this course I can further bridge that relationship on how culture influences healthcare delivery so that I can become a more skilled provider both here in the United States and hopefully in future international endeavors. More fun facts about me. The most interesting place I visited is the Havasupai Indian Village in the Havasu Canyon in Arizona. It's the most remote community within North America, accessible only by chopper, a strenuous all-day hike, or by donkey and mules. It's in the middle of the desert, but it's home to some of the nation's most stunning waterfalls. Upon arrival, though, after an all-day hike, the tribe members are overall pretty cold and unfriendly to tourists, and the donkeys, mules, and dogs are underfed, and they had sores and exposed ribs. There was a lot of obesity, alcoholism, and just litter. Litter was everywhere in this beautiful sacred land. I struggled with that, but I had to put their culture into a historical context in terms of how they were treated by the U.S. government when the railways were built or when the Grand Canyon National Park was formed. I also have to understand how other cultures view the purpose of animals outside of modern-day Americans, or the fact that they don't have many preventative and wellness healthcare services in this remote village. This shapes who and why they are this way. Overall, it was a fascinating experience. My heritage is 1/2 Anglo-Saxon, 1/4 Polish, and 1/4 Italian. The Faenza family immigrated through Ellis Island and settled into a very industrial Providence, Rhode Island. The British side of my family came to South Georgia and also pursued the American dream, but had to survive a very bad cholera epidemic and Civil War unrest. I'm proud of my heritage because it blends lines. The North, the South, the working class, the privileged. I am not one for social boundaries as a friend, nurse, or a family member. When I think about my cultural beliefs, a big word that surmises them is sensitivity. I hope my SRNA friends listening to this consider me as a sensitive person. Sensitivity and humility are keystone words when thinking about global health, social responsibility, and caring for diverse populations. In any aspect of life, when we interface with other cultures, we need to check that superiority complex at the door. America is home to the most advanced healthcare and growing diverse population. I saw that at the Proton Center last month at Shands. Amish children, patients from Mexico, Britain, Egypt, Brazil, Malaysia. Speaking of diverse culture, my colleagues and team members that I'll be working with in this career will also be of different backgrounds. One of the first covenants we assume in healthcare is primum non nocere, or to do no harm. To me, that means not just to the patient's exterior, but also to their feelings, their perception of their body, their treatment, and their level of understanding of what is happening to them. Education on culturally diverse care empowers us to accomplish this to the fullest extent.